and then Uche, I'll also ask him. The first thing is that tell us your story before you knew about Hifu. What did you do? How did you know you have fibroids to start with? Then what did you do before we talk about Hifu? Victory, do you want to lead us in that, and then Uche will come in?
All right, so thank you so much for this platform. Thank you everyone for joining in. So my journey with fibroid started. It started and ended last year, but it lasted for 6 years. So at the age of I think 21, 22, I went for service. I started having this irregular menstrual cramps, and my period was not as steady as it used to be. So first I went to the hospital, they did normal checkup, they said it was a UTI. I was like, UTI cannot be causing this kind of pain. So later when I kept going back for the same issue, same symptom, they referred me to a general hospital where I went for a scan, and they did a pelvic scan. They found out that I had fibroids. So the gynecologist who attended to me at that time was like, since you have just one, don't stress yourself. It's like the size of a golf ball. It's not affecting your life. You can go ahead and do any other thing you want to do. So I was like, okay, fine, no problem. Let me go with it. So I left that hospital. I went on to do other things. Then later, let's just say 2 to 3 years along the line, I'm not able to, have a complete day, especially if I'm saying my period. I have to cry out for pain, sharp pains. So I had to adjust my dieting, my clothing. So if I want to go out, I have to put fibroid first before doing anything. Like it was like an invisible child that I'm nursing. Because when I'm thinking about myself, I also think about it. Because I cannot go out and maybe I'm saying my period. I must go with like 5 extra pad. If not, I'm going to embarrass myself anywhere I go. So if I don't have, my sister will keep for me, because so it was more like a routine we do every month. So when my period comes, I'm always like, here we go again. Another series of church. I'm like, God, why do women have this kind of thing? But not knowing that the fibroid was multiplying, and from 1 it graduated to 3, from 3 it became 5, then later became 7. So I was like, okay, so what am I going to do about it? So I tried to get solutions on how to remove it. So I started telling friends and family, loved ones. So some people started suggesting different kind of concoctions to me. If I start itemizing things that I've taken, things that I drank in the process of trying to do it in a non-invasive way, because I was scared of surgery. So somebody recommended one herbal drink for me. I didn't even bother to ask what it was. Next thing you know, I downed like 2 bottles. Then I became curious. I'm like, anytime I take this thing, it's always hurting me in my bowels. It's always like something is eating me up. So that was when then I explained to me that I took alligator pepper and camphor, grounded camphor. I'm like, excuse me, what did you give me? So next thing, I started having issues. Maybe if I'm going to urinate, I'm always urinating every time. So imagine if I kept on taking that thing, I would have damaged my kidney or my liver, because I'm not supposed to take those things. They'll tell people that this thing will cure fibroids. All the herbal marketers, they were with my number. They always want me to patronize them because they have one fake testimony or the other to give me that this drink, when we drink it, the fibroid will melt away, it will peel away, it will disappear. So there was nothing I didn't take. I took drugs. Some said the drug is from India, one country like that. They mix it, it's not in the market, so it doesn't have label. So I'm very sure I've consumed drugs that are not even qualified or acceptable in the open market, just because of my desperation to remove fibroid without surgery. So when I took all of that, I was like, God, no, I can't do this. Some even took me to church. Some said they want to take me for deliverance. And one pastor, once he lays his hands on me, he's going to heal me of my fibroid. I believe in Jesus, but it became a matter of business for some people because they were not trying to guide me and try to make me understand that, okay, there are ways to go about this without, falling into the hands of these scammers. Let me call them scammers because none of them yielded any solution to me, but I ended up spending a lot. So that was how that journey was for me, and I do not wish it for anybody.
Thank you. Thank you. Now, why we're doing this is because we know that there are thousands of, I don't want to say millions of women who are going through this at this point in time. And they're falling into this wrong hands also. And we need, the minimum we can do is to share our experience so that people don't fall into the same trap. Yeah, so Uche, tell us your story.
Okay, I had my first hello everyone before I start talking. My name is Uche. Okay, in 2011, I started having very heavy periods that all my friends knew one of my periods because I can't sit. I have to stand. My second day, third day, and fourth day were crazy. They come in large lumps. I can't sit. I have to stand. Then when I go anywhere, I'm going out of my comfort zone. I have to take extra clothing. It got to a stage I started using adult diaper. It was that bad. So a friend now told me I should go and see a doctor. I now went to see the doctor. He now said I should go for a scan. When I explained to him how I was feeling, because after every period, I'll be dizzy. Then I have to take blood tonic and all that. So the doctor checked and it was fibroids and they were large. So he advised me to have them removed. So I had my surgery in 2012. Happily, everything was okay. Then after a year plus, I noticed that I started having heavy periods again. I was like, God. Went back for scan by myself and I saw, they said they were tiny, but insignificant, that I should not worry. So that's how I continued. Somebody advised me to change my diet. No sugar, no rice, no yam, all those sorts. I stopped, no milk. So I stopped eating almost everything. Very boring diet, just ripe plantain. Oh God. I was just eating things that were if I go for parties, I won't be able to eat because I don't watch other people eat. You can't do anything, just drink water, or then fruits. Then fruits, you can't take orange, you can't take, there's some things I couldn't eat, yeah. So that's how it was till it became bad again, that the clots were not getting large like before. I went for a scan and they said that their wound are big. God. And I said, I don't want to have surgery again because the pain of the first one, the healing, I know how I fought the doctor before I agreed to take blood because they said I lost blood, I have to take blood. I was afraid of the stories you hear of infected blood, mistake giving you the wrong one. Anyway, I have to take the blood. So I didn't want that again. So I started checking how to remove fibroids without surgery. And I got to herbs. My story is serious. Okay, there's one I bought online, 3 months package for 480,000. And they told me that in a month it will start shrinking. After a month, I ran to the lab, I checked, there was no difference. Then there's another one they got from Imo State called Ajumpise. You drink one in a bottle that was so bitter that you throw up all day. The woman even told me I shouldn't go out the first day. I took it. Then before you start the other one, it was horrible. There's another one I went into, I'm so sorry for my journey. I went into Sulere. The lady gave me some powder that I have to mix with schnapps. I took that also. That one, the smell was horrible. I didn't even know what I was drinking, cow poo. I don't know what I was drinking, Sha. I took it, nothing. Because each one I take, I'll go for scan after a month to check. We will see the same thing. So I said they won't get bigger. Then someone referred me to one herbal doctor at Saboyaba. I can see doctor's face like. I went to Saboyaba, the herbal doctor was there. Everything cost 500,000. Yes, I bought. Nothing. I still have my house, I packed each one to just tell people my story later. I drank that one. After a month again, I went to check. There was no, somebody told me of another doctor at Isheri. I traveled to Isheri. I met him. He gave me there was one in bottles, another one in capsules. I took them. There was nothing. Even self, the period even became worse. The time it turned to 2 weeks, it will not stop for 2 weeks. Then I had to tell my gynae the 2 weeks. I had to go to my hometown for my mother's funeral. So he gave me a drug called Primolu to take to stop the flow, so I can be able to do the funeral and have peace. Because that time my period was 2 weeks, sometimes 3 weeks, it won't stop. So I took the Primolu. 4 didn't work. I had to start taking 8 in the morning and 8 at night for you to know how bad my flow was. Yes, 8 in the morning, 8 at night for you to even reduce. So after the funeral, I came back and he told me to stop. And now started again with the heavy flow. I was still checking how to stop fibroids, how to cure fibroids without surgery. I got to hear about laparoscopy. I called the doctor. He's in Abuja. He told me to send the scan. I did. He said, because of the sizes, that they can't do it for me. I have to go for surgery. I didn't want surgery. I went to another herbal place again. They gave me this one was in somewhere in Ikeja. The lady gave me some capsules and herbs. I couldn't take the herbs because of the smell. The smell alone, I started throwing up. So I threw it away. I wasted my money. I didn't even take that one. I was tired. So one day, and I opened my Google. I just wrote how to cure fibroids without surgery. Some things popped up. As I was scrolling up, and I saw Dr. Ajayi talking. I saw what he's talking about. I opened it. He was talking about Hifu. I was like, what's happening here? And I clicked, checked. The address was in Lekki, close to my office. I drove there and I sat down with them. The lady was very nice, asked her questions. She told me that's how I went to meet the matron, Mrs. Hannah, spoke to her also. And I went to start saving my £1. And I had my procedure in June. And I won't lie to you. I've had my period how many months now? I don't even remember that my period. The flow is not heavy. The first day I'll have little cramps, and that's it, I'll be fine. I don't even know how to explain, how to say thank you for this new procedure. Thank you, Dr. Ajayi. That's all I can say. Thank you.
Welcome. Thank you. Thank you so very much. Yeah, as you were talking, the two of you, I was putting down a few things because they're familiar things that you hear. Okay. Like Ricky said, she took drugs without labels. And sorry, that nothing can be as dangerous as that because you don't even know what you do. And there's so many women going through this right now. Your own story, Uche, it's also one of the stories that's very interesting. You had surgery, okay, but there was not a recurrence. And that's one of the things also that we're seeing a lot. Surgery is a wonderful way of treating fibroids, okay? But like we all know, it's an invasive way of treating it. And of course, any method that you use, let me say that up front. Any method that you use that you still retain the uterus, there's a chance of recurrence, including Hifu. Okay. Yeah, but it's just that the chances are different. Okay, the probability of recurrence may be different from one to the other. And the beautiful thing about Hifu, again, is that you can repeat it. Unlike surgery that is invasive, you can repeat it because it's ultrasound. Okay, so it poses no risk to you, to your reproductive tract, to anything. So it's like you're doing scan, like you've been doing scan again and again and again. You can do it again and again if, for example, the symptoms ever come up. But what we know is that the symptoms, like we said, 391 people now. And how many do we have? We have a few people who, the major problem that we have with this is probably people who compare it to surgery that is still there. The fibroid is still there. That's what we hear most of the time. I've gone to do scan. They said the fibroid is still there. We didn't say we're going to remove the fibroid. We said we're going to kill the fibroid and so that your symptoms just disappear. And that's what I want we're focusing on a lot during this program, on how the patients can understand what we're doing and what we aim to do in the first place. So that it's not that you now come back and say, oh, but the fibroids are there. But what we do is that we show you that the fibroid is shrinking. because it's going to shrink over time, and then your body is going to. Some people we've scanned them that there is no fibroid anymore, but it's not. We're not promising that that's what will happen. What we are promising you is that in 1 year you have at least 70% reduction of your fibroids over time. But I want us to, one of the things again that makes Hifu to be, for me, why I'm so excited about it is the fact that the complications from Hifu cannot be compared to the complications from surgery. We do surgery on a daily basis, and so many people don't have complications. But when they do have, like you needed to have blood transfusion, you knew what you went through, even for you to agree to blood transfusion. Yes. For some people, it's worse. Not because the doctors are no good, but because of the location of the fibroid sometimes. We have seen women who will not menstruate after their fibroid surgery, okay, because their baby trauma has been stitched together, inadvertently. We have people who can have what we call deviate thrombosis, usually for people who are obese, and they have the likelihood of forming blood clots in their system. When you now make them to lie down for about, how long did it take you before you started doing normal work after your surgery? 2012. How long were you at home for before you started doing normal things?
Okay, for me.
Did you do surgery too, Vicky?
Okay,
no.
okay, I thought it was for me.
It's Uche.
Okay, after the surgery, I was in the hospital for a week, then discharged. Then I was home for 2 weeks. Then after 2 weeks, I was told I can resume work, but I can't lift heavy things. I can't do this. I can't do that. So let me say a month. It took me a month to.
So 1 month.
Mm-hmm.
After the Hifu, how long did you spend in the hospital?
I resumed work the next day. I wanted to go to work that day. Nurse Hannah said I should go home. Yeah.
Yeah, so those are some of the advantages that we want people to see when we talk about Hifu. We know that it's not everybody, but maybe before I go into the people who can do Hifu, people who cannot do Hifu, I want you to describe your experience. Victory, tell us the process itself. Tell us, we're coming back to you, Jane. Tell us the process itself. How did it go that day? I know your own is over 1 year now, but you have to bring to
okay. So I started with the prep. So before coming to the clinic for your Hifu, you have to do like a 3 days prep where you empty your bowels, you have to check in with the nurse, you check your vitals, your BP, everything basically. So after which you are then escorted to the Hifu room. Let me not call it operating theater, Hifu room. So you are escorted to the Hifu room. So while you are there, you are going to be asked to lie down on the machine. So while you're on the machine, you have the doctor on the screens, multiple screens. I think I could count like 6 screens that day. He will be there. The machine has like the imaging is, it's quite high tech. So I don't know how to explain the imaging and everything. So they already know where to go to, no need to waste time. So it was very, very fast. So after lying down, the nurse asked me if I was comfortable. So she made sure I was comfortable, first of all, because my comfort was what mattered at first, because it won't make sense to be lying down there and I'm not comfortable. So when I told her I was okay, she asked me to lie down. Then the doctor asked me to lie down well to ensure that I am well positioned on the machine, because he could see it from his end. So after lying down, since I had 7, so I think mine was like 7 steps. So they had to treat it one by one, from the smallest to the biggest. That was how I think it started, from the smallest to the biggest. So after which, I'm not sure we spent up to an hour in the Hifu room. It wasn't up to an hour. Then after which, I was asked to lie down so that my womb can cool off. I think I lied down for like an hour or 2. So let's just say approximately I did spend up to 5 hours in the hospital, and I went home that same day. That same day.
Okay, so when did you start doing normal things after the procedure?
Normal things that same week. I started eating my food. I started I didn't want to go back to work that same week because I took leave of 2 weeks. So I was at home, but doing normal things, I was able to do it. I can eat, I can lie down the way I want. I can, lift anything I want to lift. I can bend down. So there was no restriction to my movements at all. There was no restriction. It was just as if I came to do excursion and I left and I came back to my house. Yeah.
Okay, Uche, yeah, tell us your own experience.
Okay. Like she said, I was given medication to, of course, to clear your system the day before. Then you come in, of course, you no food in your system, then you lie down. It was a little bit painful. Mine took like 2 hours because I had multiple and I had large ones. So it took time. But the nurses were really great because they will calm you down. The doctor did his best. When they were done, that was when I was giving painkiller, then lay down to rest. I was giving lifting, then told me I had to be there for 2 hours before I can go home. So for them to watch me, so I stayed with them for 2 hours. Then I went home. Then I almost went back to work because I asked her son, I said, can I go to work? She was like, no, go home. I said, but I'm okay. She said, no, go home and rest. Then you can resume work the next day. So the next day, she called me to ask how I was doing. I said, I'm in the office. She just stayed laughing. So I was already at work the next day. So I was okay. They told me when to come for checkup, and I went for my checkup. So I was told I have to have hysterectomy, whatever you guys call it, to remove the one inside the cervix. So I've done that, although I have to do it again because I said I have to do it twice. They couldn't finish it the first one. Yeah, so it's totally different from surgery. I won't lie. I got my life back in the next day. In short, that very day. By next day, I was back to work, and I was told I can eat what I want to eat. There's nothing like don't eat rice, don't eat yam. I should eat my food, of course, in moderation. Now I'm fine. Yeah, I've seen my period, no heavy flow. Because and you go for your checkup every 2 months. So last one was last week, and the fibroids that were large. The biggest is 7 mm. I even have the list. I told the doctor to give me the list of the sizes, and he did. And I don't even know how to explain it. It's like magic.
Now, I have a question here. Somebody, and you have actually started answering that question. He said, what were the sizes of the fibroids that were treated?
I didn't go with my scan, but I know they were massive, because the first doctor that I went for laparoscopy that told me that he can't do it, that they're big, that they can't do it. So he said that one was as big as baby of 5 months. That's what the doctor said from the size. So there's no way they can do laparoscopy. So I go for surgery. So they were that big. So when I was in pain the day of the Hifu, they said they were on the big one, the doctor, that I should just relax. So because they had to go through each fibroid one gently to be able to kill the blood supply, and as they explained to me. So I knew I had multiple and they were quite large. Even from here, I can count the measurement doctor gave me. 1, 2, 3, 4, 5, 6, 7, 8. More than 10. Yeah. They were massive.
Yeah. And that's one of the things that some people are still saying that big fibroids cannot be treated by Hifu. That's not true. People concoct things in their head, and they don't even want to understand what the facts really are, and they just say, oh no, this is, I've heard so many people say, oh no, Black people have big fibroids. Hifu is only for small fibroids. That's not true. We've treated fibroids as big as 34 weeks in fibroid center. So yeah, but I have this compelling message which I'm going to read. Good evening, doctor. Thank you for giving us this opportunity. I have a DVT, deep vein thrombosis, aka blood clot on the left leg as a result of multiple fibroid, putting pressure on the blood vessel supplying blood to the left leg, which cut off blood supply to that leg. I'm currently on a tumor shrinking medication. Prior to surgery called Zoladex. I still have a dark swollen leg, but has really improved compared to when I just had the activity. Because I will say that you should come in and have your fibroid assessed. If you can do Hifu, you'll be better off because you've already have a DVT without surgery. If you are immobilized at surgery, then it's either they're going to start you on blood thinning drugs like heparin, or you might have this again, and it could be more, what can be worse than just DVT. So please, I think you need to, you can pop in to have your, you don't need, I've seen you had your hand up, but since you sent the message and I've addressed your message, so we can, you can even just send us a bill, send us the scan report, but preferably if you can send us the images so that we can also see the images. Yeah. So there's another one. Hi, I live in Canada and had surgery in Toronto 2021. I was there. However, 2023 September, I did an MRI. Unfortunately, the fibroid has returned. Hearing from the ladies, it sounds like a success. I'm interested. My fibroid are now 1 cm and definitely in a few months it will grow. Okay, we'll see. Yeah, you can also drop us a mail if we can help. We'll be happy to help. Yeah. No, this Ngozi is really writing a lot. Please, we would love to have just a chat with you and see if there's anything that we can help. It will be okay. How safe is Hifu procedure for a DVT patient like me? Being a non something, I don't know. She didn't complete that. But what I'll say is that Hifu is probably the best thing that you can actually do if you have had DVT, because you're not going to be immobilized. You know? So just you've heard all the two ladies talk about that very day you start moving. So that takes away the risk of immobilization. Okay. Somebody is also asking you a question. So the biggest size operated on, have you gone back for a scan to check if it's reduced?
Mm-hmm.
Yeah. Okay. So she has answered you. The person is not. Yeah.
Yes.
Okay. So she said, no, I've seen the conclusion of Ngozi's for DVT patient like me being a non-invasive, very safe, very safe. So, but we need to see that you actually qualify for Hifu. I think that's where that's where the main work is because it's not every patient who will qualify for Hifu. Yeah. But size is definitely not a contraindication. The location can be a contraindication sometimes, but that's what Uche was even saying, that sometimes we have to combine Hifu with hysteroscopy. Okay. So that if your fibroid is where the baby should be, what we call a submucous fibroid, and it's good, we see that they might damage the endometrial lining. We're not going to touch those fibroids. We come and do hysteroscopy to do surgery. So with that, what we're doing now, we're combining Hifu with hysteroscopy, all in a bid to make sure that we avoid surgery and that you're safe and that your reproductive potential is not in any way put in jeopardy. So those are some of the things that but we want, who can do a Hifu and how much does it cost? Yeah, we come to that. Now, I want you to discuss with us, I think you have said it, how has this affected your quality of life post-Hifu? Has that been an improvement? You see, because what you have described to me, the two of you, whether you like it or not, is that fibroids affected your quality of life.
Yeah, I did.
Yeah.
So,
and I had to put fibroid first. Okay. In all your doing, it has become like the Bible said, get wisdom. So she had to be putting fibroid first. But now, how is your quality of life? Let's put a start and then we come to victory.
Oh, perfect. Now it's perfect. Now I do my period. The first period after Hifu, when it started, I didn't even know that was my period. That was my office. I just felt something. You know how you just feel something, and I got up to check, and I was like, wow. And I told my colleague, I said, I'm on my period. They were looking at me. Anyway, someone now gave me the pad to use. Unlike before that, I don't even use pad. I have to buy I buy that massive one, and now wear another diaper under to protect myself. I was not afraid at first, but when I found that the thing wasn't even filling up, till I got home, I was okay. I was like, wow. And I called the nurse the next day to tell her. She said, that is okay. I said, are you sure? She said that I'm okay, that I should continue with my life. But is there anything I should call her? That's how the thing ran for the 5 days and was okay. Then the next month again, the same thing. So it's totally different. Fine. Although still behind my mind, I still carry one of the diaper in my bag in case. That fear is still in me, but I've not used it. I just have it in case. It's just the fear, but I'm okay. Nothing. I've not had the lumps again. Nothing. I'm okay.
Thank you. Yeah. Okay. Yeah. Victory.
Yes. So far so good. This is my 1 year post Hifu procedure. Is it 1 year? Okay, 1 year in July. So let's just say I'm going to my 2nd year next year. So far so good. I'm currently on my period right now, and on a nurse. Today is my 2nd day. I should have been on my 5th pad or my 4th pad today, but to the glory of God, let's just say in a pack, if I have 7, I can use that 7 for 5 days of period. So 1 in the morning, 1 when I want to sleep. So the blood clot, first of all, it's gone. Sometimes I'm even looking for it. I'll be looking for it when I bring it out. I'll be like, God, where is the blood clot? Because that was my number 1 issue when my period come then, as at then. Because the blood clot will be plenty. There's one very thick one that comes either on the 3rd day or the 4th day, very thick and painful. When it comes, I'll be like, hey. So since that time, I won't lie, I've not seen it. For the blood clots, nothing. Just like Uche said, when the period comes, no pain. I can't remember the last time I took Fervin. I can't remember the last time I took paracetamol for my period. So when it comes, you just feel it like, that's come, oh. Okay, oh. It will just come and go, be like, I'm going, oh, bye. That kind of thing. And I'm like, just like that. Like the last one I had, I was even telling my sister that my blood is not much. Oh. She's like, do you want to be bleeding? Isn't that what you have been praying for? I'm like, yes, but you know, this African mentality now, when something is too good to be true, you are always expecting the worst. You're always expecting, that thing. Let me just still see it will still happen. But it's not like that. Now I can go out, like the group I belong to now. So after we do our fibroid this thing, we can now wear white. So now I have white trouser. Before I don't have white trouser. Now I have white trouser. Unlike before, I cannot buy it. I have white trouser, I have white gown. But when I was nursing fibroids, you dare not catch me wearing anything white. You will never ever see me wearing anything white.
There's a group called you can now wear white.
Yes, it is like a slogan for us, but the group is My Gynae. We call it My Gynae Foundation. Yes. So after our fibroid surgery, we now gather together, wear white, and say, yes, we've defeated fibroids. We can now wear white. Yeah, I'm very sure people that have fibroids can relate. You dare not wear white if you're battling fibroids. People are laughing. You cannot wear white. They know what I'm saying, because once you wear it, you cannot even buy white pints because that pint is gone. It is gone because who has strength to be washing plenty blood?
Yeah,
it's always massive.
Oyinkan is agreeing with you.
Yes, so she's our convener.
Parties. You can't go for parties. You can't go for parties. You can't go for parties.
Yeah, you can't go for parties. If it's a team party and white is inside, you cannot even wear white cord lace because your period is irregular. It can come anytime. You go as far as seeing your period twice in a month. It is that bad. So now you can wear white with pride. You even have shoulder pad, everything when wearing the white.
That's the thing that probably doctors don't even know about, This when we talk about quality of life, these are some things that women go through that the doctors probably are not even aware of,
Yes.
Yeah, so until you bring it to our attention, we probably will not know how some people really have to live their life. Like you said, put fibroids first.
Yeah,
Yeah.
so
Yeah.
you can't go
Yeah.
to party. When you're in a party and you're like, oh, my period just came. Other women will be like, it's not the same period I see, but you're not comfortable telling strangers that this is what I have. Many people don't have that
Experience.
Exactly. When you tell them, they'll be looking at you one kind. So you can't go about telling people that it's because I have fibroids, and the story is plenty. You go talk, you go explain tire. So many of us just prefer to just stay at home. When it's time for bed, we will not go. We will be at home. But now, it is a party. Any party you invite me, I will go. I will come. I will borrow transport fare and I will come. So my life has been amazing.
I can remember a party I went for, and I was at a party, and next night, you know how you feel the lump fall, boom. As it fell, I jumped up from the seat. So people were looking at me like, what's happening here? I knew, once it falls, there's this liquid one, they just follow it. So I knew that if I don't leave this place, I'm going to mess up myself. So you just have to walk, and you cannot use the toilet of the hall because you have to clean up yourself. So just go. Since that day, once I'm on my period and there's a party, I'm not going. Because if you sit and you stand, that thing just falls. Did it happen to you? The large lump.
It was blood clot I'm talking about.
Yeah, so it's horrible. You can't live your life. But once you are free, I don't know how to explain the freedom from fibroid. I don't know how to explain it because it's horrible.
So look at me now. I went to like 4 different places today. I'm here and I'm seeing my period currently. Today is my 2nd day. Unlike before, I'm like, help me. I'll be lying on the floor, tummy face. I had to even buy this tummy warmer with power bank, so I'll power it. It will be warming my stomach when I'm seeing my period. It is that bad. In the night, I can't sleep. I'm resting. I'm like, my sister will be petting me like baby, my baby sister. I became baby because of when my period is. Oh God, it's crazy. So I cannot wish this thing for my enemy. So I am always celebrating the fact that I am free from fibroids. 1 year free. It's not easy. I even gave my testimony recently in church, and I'm just grateful. Like, I don't know how to explain it. If you give me from now till tomorrow, I cannot, it's not enough. Let me just put it like that. But thank you so much for what you're doing, sir. I really appreciate what you're doing here at Nordica.
No, but I think it's you guys that we should thank for coming out to talk about this. I think this where, I'm so happy that we're beginning to move away from this hush-hush things in Nigeria, which has allowed a lot of things to go on with the medical system in Nigeria. That's why we have so many claims, unsubstantiated claims, because people don't want to talk about whatever they are facing. And I thought I knew so many things about what women face, but on a daily basis, I learn more. I didn't know about this whites. I didn't know about this. I've heard it before. I remember that during my endometriosis campaign, Nikki had mentioned it at one time. But it was just like, now for a group of women to come together and say, we can now wear white. That is something to me. That's something to me. Yeah, Dr. Mwagu, thank you for joining us. I see your comments. Thank you. And now there's a comment here. Some say that some people say Hifu might have some cancer-related side effect. Is this valid? No, it's not valid. It's ultrasound, so it's not doesn't have any cancer-related side effect. Okay. So now, one of the things that I know there's a lady who doesn't like to greet me anymore because he said she can't do Hifu. Well, I understand her very well. I wish we could help, really actually, but why I'm saying this is because of the fact that Hifu cannot be done for her. Right? She had done surgery. I think the first one was either in the US or Dubai or somewhere. She's done 2 surgeries, okay? She's done another non-invasive method, and she was thinking she'll be able to do it because the symptoms came back. And when we examined that, we said, no, we are not fit for IFU. And so it was like everything she just dashed, like a dash home, and she just didn't like it at all. Yeah, but unfortunately, we'll continue. We have to stay on the side of safety. Okay. Once we see that we cannot treat your fibroids with IFU, we'll let you know that. For some, we might have to recommend that they do laparoscopic surgery. And that's also, somebody asked that question, what's the difference between laparoscopic surgery and HIFU? Now, laparoscopic surgery is still surgery. It's just done through a keyhole. Okay. And it can be through the abdomen, which we call laparoscopic surgery, or we can do hysteroscopy, which is through the vagina. It's still, the two of them are minimally invasive surgery, but they are endoscopic procedures. And endoscopy means that it's like telescope. We have an instrument like a telescope. So it depends on where you're coming from. If you're coming from the abdomen or if you're coming from the vagina. The abdomen still leaves a scar, but the one from the vagina doesn't leave any scar, which we call the hysteroscopy, which is what you have done. You have done the hysteroscopy. Yeah. So, but HIFU is completely different. You can do another question that I saw there that can forward into HIFU and do IVF. Of course, we've had many pregnancies now for women who have done HIFU and they have gone ahead to do IVF. Okay. So they're not related at all. And HIFU does not affect your fertility. You know, so because HIFU is ultrasound converted to heat energy. It does not affect your and we've done, even in Nigeria, there are studies which we are going to publish soon, shows that the ovarian reserve is not affected. So, somebody, okay, I see I have some interesting questions now. Funny enough, I have never had any funny fibrous symptom. No heavy bleeding, no cis menstruation, no waist pain, only for me to have intimidity. Okay, that's because somebody's asking, what about the backache? Did any of you have backache?
Yes, I had backache before HIFU because of the fibroid, but after I've not had backache since, and I'm 6 months now. 6 months after HIFU. This is my 6th month. Yes, and I've done scan 3 times now with the doctor. Yeah.
Okay.
I never had backache. Mine was frequent urination. I think that was my most common symptom. So if a pregnant woman and I were to be in a competition for who pees the most, so I think I would have won her, because where my fibroids were located, they were in between my bladder. So one on this side, one on this other side. Then my bladder was in the middle, so it was compressing my bladder like this. So if I hadn't done HIFU, would have started talking about kidney infection or liver something, because it passes, or it presses the urine to go back to where it's coming from. Like, I am here, I'm the landlord. So that was what was causing my own symptoms. So I just feel everybody's symptom is different. At least Dr. Ajayi can explain better.
Yeah, that's what, because they also said that she did not have any symptoms, but she had a DVT. You know, and that's like the extreme of the symptoms. You just have, like, you start forming blood clots, which is because your blood in your legs are not, because of the mass that is compressing always there. The blood around you, so you form blood clots and that. Yeah. Yes, Amina is saying that she has a fear for MRI. Okay. Maybe we should talk about this later on. Amina, I would like to know, is it that you, because of the enclosed space, because I know some people are also, they fear MRI machines. Yeah, but we for us to be able to do HIFU, you have to do MRI. Because we need to be able to be sure that there are no other things that are being missed. For example, one thing that we've not spoken about is, which I resist talking about most of the time, is adenomyosis. Because sometimes some people don't only have fibroids, they have adenomyosis. We've seen in our own figures that about 15% of the women that we have seen also have adenomyosis with their fibroids. And so, but the good thing is that adenomyosis can be treated. The best way actually to treat adenomyosis is Hifu. So we can also treat adenomyosis with Hifu, but we need to have made the diagnosis before we start the treatment. So we are particular, but not only that, even after the treatment, the MRI is also a way to show that we have actually done what we are supposed to have done. Okay, so I think this is, can a woman who is giving back to us? Yes, I've answered that before. Yeah, I'm always having serious back. No frequent pain. I was just a regular woman until give it to me. That's telepathy. Okay, I already did an MRI and had a plea. So I have to repeat it when I'm ready for the procedure. Depends on how soon. I think we would not want to take more than 6 months, so but depends on what the MRI is. Just send us the MRI if you have done it, and then we'll be able to see whether we can take it. And then, yeah, Amina still has. I've been to the Fibroid Center, and like I was referred from last week to Medical, but I've gone to Africa Global for the MRI, and they booked it from me. Okay, so we are progressing. Does fibroid lead to fatty liver? Well, I don't think so. I don't think that. But I'm not an expert on fatty liver at all. I'm a gynecologist. It's this gastroenterologist who look after fatty liver. But I don't know. I'm not aware of any relationship between the two. Okay, I think we need to be ending now. How much does Hifu cost? Well, please phone the center, because if I tell you the cost now and the price changes, I don't want you to hold me and say I said this, because we all know what the dollar is doing now. Can fibroids this period, constant infection, and also respiratory discomfort? No. Is it safe for IVF? Yes. Will it cause carrying? No. Which might lead to embryos? No. It does not cause carrying. We don't cut. It's a uterine sparing procedure. You don't cut at all, so there's no scarring. So just as approximately costs. This person is after my life on this cost. Okay. I'm intentionally keeping away from the cost, because please, sir, do discount for us.
At least that is not asking for giveaway.
Let us ask the federal government to do discount for us. Anyway, we'll see what we can do. That's one of the things that what we have done now. We have done this for 2 years. 2 years, 4 months, and we've changed the price only once, despite the fact that the dollar had changed severally during that period, because we're aware that, so I don't know whatever that still has the same price 2 years ago that still has it now. The price we are running now, at least we've run it for over 1 year. Yeah. And so seriously, I don't think we can continue that anymore. We probably have to put a small increase into it so that we'll be able to also diesel is now 1,400 per liter. We that light, most of the things we can't do without light. We know that banks even are switching off generators now. We cannot. So it's terrible. So we need a lot of money to be able to run what we are running, and we cannot. We need to. So when you ask me for discount, it's like I don't know what to say. I know it's difficult to come by. Naira is difficult to come by, but also the value is depreciating on a daily basis. We pray that this will be able to get a stable naira so that it's easier for us to plan. But don't let us talk about money. Let's talk about the procedure. And do you accept insurance cover? Well, if you have HMO who are who want to sponsor you, we can talk about it. And we also know that we have some groups. There is a particular bank that is also there helping us give some people free treatment. Yeah, Access Bank is doing that. So, but of course, it's just also a drop in the ocean. We are looking at if we can see more HMOs that can get involved, if we can see more banks that can get involved. But we have to give kudos to Access Bank. They've been supporting the initiative.
So I'm also an ambassador for that Access Bank project. It's called Project 111. Yeah. So if people are interested, they can go ahead to search for it on YouTube. It's called Project 111. On Instagram, Project 111 as well. So they are helping a lot of women by providing subsidized, should I call it subsidized fees for their Hifu procedure. So we already have some women in the pipeline. So if there's there's space for more, you can be added. So don't say they have their winners already. Just apply. I was a beneficiary and you could be one as well. So I'm not being paid for whatever I'm doing. This is my own way of paying it forward because I know there are several ladies in my own position.
Someone is already taking you up. How can I apply?
Yes, you just have to go to their page on Instagram, Project 111. It is together, no space. Project 111. Yes, Project 111. Just go to YouTube as well. My interview video is also there. So every information you need is on their page.
No, please stop it, Victory. Now all the questions are going there. Let's talk about who page.
I wanted to save you from the discount question because that's the only way now.
I'm really joking. I'm really joking. We owe it a lot. We owe it a lot to Access Bank.
Yes, they are doing so much.
Yeah, we can get so many banks like that who also are responsible for the care of the health of women. Yes. I think it will be a better place. But finally, we still have to see how government can help us to do some of these things. But I don't know. But thank you so very much. I think we have to come to an end right now. Okay, you can, yes, it's always saved. Don't worry, you can have a copy of the recording. So Victory can make sure that you have that copy of the recording. So thank you so very much, two wonderful ladies. You made my evening, and I intentionally didn't want us to say some things about who qualifies because you can place a call. The center will go through all your data and let you know if you qualify or you don't qualify, and then we are very responsible because we want this procedure to become popular because we know that's the future of fibroids treatment. Okay, so we're very responsible with this thing now that we know we have to keep it and preserve the future of this treatment for the whole fibroids in Africa. About 70 to 80% of women before the age of 50 have fibroids. So it's something that we need to continue to talk about. It's something that we need to start looking for safer ways of treating. And that's what brought Nordica into all this. So I think on this spot, all I can say is that thank you so very much, Victory and Uche, and definitely maybe one of these days we'll have another chat somewhere, somehow, and then is it too early to Dr. Lubai is also saying hi. That's from the Fibroid Cast. Yeah.
I'm trying to share the Instagram this thing because so that people can just go there and see.
Exactly.
So yes.
So is it too early to say Merry Christmas in advance? Because I've started seeing Christmas lights in Lagos.
Yes. Yeah. So
it's even a good thing that in spite of all the things, the Naira, everything going around, let us even see something to celebrate. So
yeah. The fact that we are all alive is worth celebrating.
Yes. And so, yeah. So thank you so very much, ladies, and I wish you the very best. And
thank you for having us.
Thank you. And for all those who joined us, thank you for giving us your time. And we hope that if you need more information, you can talk to us, you can talk to Uche, you can talk to Victory, and they'll be able to help you out. Thank you for joining us, and see you some other time. Thank you.
All right. Thank you so much for
Bye.
having me, Monica. Thank you so much, Dr. Ajayi. Bye, everybody.
Bye, everybody. Bye.